Hello and welcome to Let's Talk About It. This is your host, Taylor, and I hope you all are enjoying Masturbation May. I know there are so many things going on in the world and probably a lot of things happening in your own personal life, but hopefully you are able to make space and prioritize your own pleasure, which you do nothing to earn because you just deserve it, just as you are. So I'm really excited about today's guest. I want to introduce you all to Dr. Heather. You might already follow her on Instagram. She is a board-certified OBGYN, currently practicing in New York City, in the Bronx area. She has over 10 years of experience in the medical field. She recently just did a AOC had posted her, and they were collaborating on a project. She just really does so much. She worked in the United States Army as an OBGYN for about 8 years, and just really excited to finally have her on and share her with those of you who aren't already familiar with her. So be sure to check out her Instagram linked in the notes, and I'll stop talking so that we can get our guest on. So let's talk about it. Welcome, Dr. Heather, to the show. Thank you so much for being here.
Well, I'm glad to be here.
Yeah, first of all, I've just been girl crushing on you on Instagram for I don't even know how long. Like everything you put out, I'm just like, oh, I feel this. I'm like, oh, people need to hear this. So thank you so much for all the work that you do put in on Instagram to help educate people on all the women's health, all the sexual health, all the vaginal health, wellness things that we are robbed of in our education.
We really are. So, I mean, I'm just happy to be able to do that for everyone. And hopefully we can continue this vagina speaking party. As I like to say, we got to speak on our vaginas and it's okay.
I love it. And I was wondering if you could share a little bit of like what the work is that you do today, like, and what that looks like. You work in a hospital right now. If you could just share a little bit of like what your day-to-day work looks like.
Yeah, sure. So I currently work at New York City Health and Hospitals here in New York City. I work in the Bronx. I'm from the Bronx, so it's really nice to be back in my community and helping out like literally the people who helped me be who I am. So my normal day-to-day is actually kind of different every day. So I do work in a hospital, but I do a lot of different things. So some days, the whole day, I'm seeing patients in the office, in the clinic, all different types of patients who are coming in with vaginal issues like itches, discharges, etc. Then for some other people, I'm seeing them in the prenatal period. So they're for their prenatal care. So making sure their babies are okay, things like that. And then I see people for like normal appointments. So it's just like your pap smears and things like that. And then other times I see people who are having issues with like bleeding and stuff like that. So that's one end of things. Then some days I'm on labor and delivery and I'm taking care of patients who are in labor, about to have a baby. I deliver babies. So that's part of my whole spiel during the week. And then another part, I also do GYN surgeries. So like if you have a cyst on your ovary and it needs to be removed, I'm one of those people who do that. I do hysterectomies where we remove your whole uterus, things of that nature. So I'm kind of multifaceted woman at work.
Yeah, I was going to say that's a lot of different things. It's like the whole realm of vagina care.
Yeah, basically anything that has to do with the reproductive, pelvic organs, uterus, fallopian tubes, ovaries, and any products of those like babies. That's what I take care of.
Yeah. And was this something that you always knew you wanted to do growing up?
Yeah, for the most part, yeah. So for the most part, I knew I wanted to do something related to women's health and reproductive health. So I didn't know if I wanted to see patients like one-on-one or if I wanted to see people like whole groups, like take care of population health. So it kind of evolved into, I really do like taking care of everyday people with vaginas and uteruses and such. But I still, in my capacity on social media, take care of kind of like the whole community, the whole group, the collective.
Mm-hmm. Yeah. You take care of me. So thank you.
I know.
And I mean, I'm wondering if you can speak to a little bit of just kind of what your educational experience was. Like, I think there are more like female OBGYNs, but I don't think there are a ton of OBGYNs who are women of color, or even that are Black women. So I'm wondering if you can speak to kind of what your experience was throughout education.
Yeah. So what's really interesting about kind of growing up in a community like, the one that I did in the Bronx is that, you see doctors, nurses, things like that, but you don't necessarily see a lot of people who look like you. And so for me, it was kind of a lofty goal that became a reality. I was like, I want to be a doctor. And that was really, like a lot of people were like, oh, okay, that's what the kids say. Cool. But I feel like they didn't think I was serious or they didn't think it could seriously happen for me. But for me, I just kind of had a great group of mentors. So went to high school and still was like, I think I want to do something that has to do with healthcare. And I had a whole bunch of people in my life that were like, go for it. And so I went to undergrad. I went to University of Pennsylvania through, again, God's will maybe or whatever. Who knows what happened? And through there, it's just like meeting a whole bunch of people who were like-minded. And I was still kind of confused. Like, I was like, I don't know, like, if I want to be, again, seeing patients. I don't know if I want to deal with sick people. I don't know if I want to touch sick people or if I want to be with, or I want to take care of groups. So after college, I actually did research for couples who were African-American couples where one partner is HIV positive and the other one isn't, and they weren't using safe sex practices. And we ended up using this like behavioral intervention to try to get them to use safer sex practices. And through that work, I actually became really interested in women's health and empowerment because I found that so many women who were in these relationships, they were heterosexual couples. They were HIV negative, but they didn't know how to protect themselves. They didn't know so many things about their bodies. And I wanted to help them know more about that. And then I was also interested in kind of like the disease processes, because it wasn't just that, people living with HIV, but they had lots of other things going on. So it was really interesting, that work that I did, and that really solidified my desire to go to med school. So I applied while I was there, ended up going to med school, and I went to med school in New York City in the Bronx, like close to where I'm from. So that was just such an awesome experience because it was like, here I am like taking care of people in my community. And I think it was really awesome for people in my community to be like, yo, I know her. She's literally from here. Or like, even if they don't know me personally, they're like, you totally understand what, like I'm talking about, because I took the same subway train to school, to work, to whatever, been to the same grocery stores, like did the same things. And so it's one of those things where we have to kind of normalize and not make it kind of like, here you are as an exceptional person from this community who's made it. Like, no, there's so many people I know who are super smart, super capable, and able to be doctors or lawyers or, like the next Bill Gates. Bill Gates is on my mind because of his current marital status issues. But, like there's so many people who are so capable. We're not less capable than anyone else. A lot of it is access or even just knowing that we can do it, Yeah. And having people to tell us, no, like, don't dream small, like, go for it. You think you can go, you want to be an astronaut? Like, seriously, look into it. You can do it.
Yeah. Well, and it sounds like you really did have that supportive community around you to help encourage you and, not let that be just one of the things that, you know, the kids are saying of, I want to be a doctor when I grow up. I'm just like, okay, yeah, sure.
Yeah, like actually do it. What was really interesting is I had an uncle who bought me a microscope set when I was like, I think like 11 or something like that, because like I have one other doctor in my family, and that's actually my uncle. He came from Nigeria when I was like a baby. He was like 18 years old. My parents helped like pay for him to go to college here. And he was like, think I want to be a doctor. And they didn't stop him. And so he was in med school. He's actually an MD PhD. So he's like uber smart. And he was in med school for pretty much my whole childhood. Well, like the parts that I can remember. And I remember he just was really like encouraged me. And he bought me this microscope set where it was like, I felt like I was cool like him because he used to like take us to his lab and like whatever. And I was like, this is so cool. Now I have like a lab in my house. So, you know, it's like people encouraging random things like that. You never know how that's going to impact like the people who come after you. So it's super important to never like, you know, don't limit yourself and don't limit the kids. Can happen.
Yeah. Oh, that's so beautiful and so true. And yeah, I mean, I think so much of our future does also very much depend on the amount of support and belief that we have in us with our social groups.
Exactly.
You know.
And then like another big thing too, that I have to hand it to like my parents and stuff like that. So like at any point where, you know, you hit roadblocks, right? Because I mean, it's not to say that I love how it's like my story. I summed it down to a very kumbaya, like it was so great. And like, everybody was so supportive and I like made it, guys. And like,
I went to this school and I did this research and then I went to this
and
other
then I was
school.
like, oh my God. Oh, trust me. Like, I remember when I went to college first, my first advisor was like, and I'm like, well, I'm thinking I might want to go to med school. I don't know. It was first semester of college, like sight unseen of grades or anything like that. My advisor at the time was like, you should think of something else. And I'm like, what? Like, you know, it was very strange because I'm like, you don't know anything about my abilities. You have not seen a grade from me. You have nothing, you know nothing about me. And your first inclination was to tell me, no, you should probably think of doing something else. And then like, you know, exactly. And it's like, why is that? Why did you think that? You know? And then like, even just throughout my career at different points, like med school was pretty chill because again, I went to school in the Bronx, very, very, I feel like the people who were teaching me, all of the, like my mentors that were doctors, the professors, they were just, it was a very interesting educational experience because I feel like they were so supportive of like what I was trying to do. So it was like, I have nothing but great things to say about that. But I feel like after that, you know, during residency training early on in my career, it was nuts. It was nuts. It's like, you know, the whole adage where we have to work twice as hard and we're not seen as doing enough, like definitely came through there where it's like, you know, some of like the work that I did as a resident or whatnot, where it's like I never had any issues learning or, you know, academic issues or whatever. But like, I feel like at the end of the day, they were like, oh, she just made it. And it's like, what? Like I stayed up all night. Like my colleagues who are not as not as dark complected as me or whatever, sleep, can answer questions wrong, can do this. And I'm like up all night, like in the books. Cause I'm like, y'all are not going to catch me slipping at all. And it's a different experience. And also like the level of anxiety sometimes you have, just like you don't want to be that person that they can say is less than, and then try to attribute it to your race or your sex or like what your background, your background is, like whether you came from money or not, you know what I mean? Like I never wanted that to be a thing. And so, you're like, okay, gonna like flip through these books and try to learn all of gynecology again for the 50th time, like overnight, because you're just scared. You don't want to be that person, you know? You don't want to fail.
Yeah, well, because from jump, people are still just trying to discredit you or, you know, invalidate your intelligence. I mean, I know I've experienced that from being very young, graduating, getting my license at a very young age of, literally before anyone even saw my capabilities as a therapist of like, well, I don't really think that she is a therapist. I don't really think she should or could be a therapist because like they couldn't actually name why. Sometimes it was my age, but it's like, no, there's other things here that like intimidate you about me and about my confidence and my abilities that you don't really think I should have.
Right. No, and it's you hit the nail on the head with that, where it's like, a lot of times they can't name what it is because you're like, because it's like one of these like things in the back of my mind. I always had, I'm like, I don't want to give them a reason to say that I'm not like, that I don't deserve the spot. Like, I don't want to give anybody a reason. I don't want to fail things. I don't want to, you know what I mean? And it's so like, it can be so harmful to you because it puts so much pressure on you. Right.
Exactly.
But like, but the haters are going to hate anyway, right? Like, as I keep saying, haters going to hate anyway. They will still find a reason where you're like, but that's not really a reason though. Like, and what it comes down to, it's like, age, race, sex. And again, your background plays a lot to it. So like one thing I remember very well was like early, and I'm not even that old and like not that far in my career, but like I'm entering like the next phase where I'm not like the new kid on the block anymore, which is kind of sad because I like being like, oh, like I'm just an ingenue, like whatever. I can't do that anymore. I'm like now in like the like middle part, I guess, or whatever, or starting that part. But I remember like, so I show up to my first job out of residency, right? And mind you, I was in the military, so there's that part. Yeah. But like, I still have flair. I've never lost that flair. So on my operating room days, I would wear like literal glitter sneakers. Like I got these sneakers on Amazon that are coated in rose gold glitter because why the hell not, right? Like why not? Like all of my patients loved it because like you're stressed out and then you look down at your surgeon's shoes and you're like, is that glitter? And I'm like, yes, it is. It is glitter because we need a little razzle dazzle today.
Yeah, absolutely. Let's bring some glitter to this hysterectomy.
Right? Like, why not? Right? Why don't people do that more often? But, that's neither here nor there. So it's like, here I am, high ponytail, glitter shoes, whatever, showing up to the party. And I felt like a lot of my colleagues who were male, because like in the military and then where I was stationed was a little bit more old school in that respect. And so there were more male docs. I was for a period of time, I was the only female OBGYN in the town that I was in.
Oh boy.
Isn't that strange, right? Oh. Like that's not usually a thing, but it was. And so I would go to the like department meetings and it would be crazy because it's like, oh, sweetie, oh, honey, like if I'm bringing up a concern about like an issue we have with patient care or anything that's going on with the department, anything that we bring up in these normal meetings where I'm like, I'm here, I'm bringing up what we should be talking about. I was definitely not taken as seriously as my male colleagues. And it was crazy because the midwives in our department were able to come to these meetings. They were more seen but not heard. So I think it was a while since they had female voices at these meetings. So I was a female voice. And even the midwives, they were the ones who also made like, I really appreciated them because, you think something and you're like, maybe I'm just being sensitive. Maybe I'm just like reading too much into it. That. And they were like,
the internal self-policing that happens.
Yes. And they were like, girl, like, how come they were like cutting you off every time you started speaking or like the honeys and the sweeties and whatever. And it's crazy because that was like, what, 4 or 5 years ago. This is not like back in the 80s or back in the 70s or whatever. This is literally like 4 or 5 years ago that was happening, and probably still is happening to anybody who's come after me. So like, it just seeing that stuff up front and close, like, and seeing that you can't like study your way out of it or achieve your way out of it was just very instructive, I think. And that's another reason why I decided to kind of get this social media platform going, because I want people to also see some validation in that. Like, you know, like you may be in similar situations that I have been, or, you know, are in currently, and no, your thoughts are valid. What you're experiencing is valid. And, you know, we're all out here just trying to, you know, we're struggling. We're trying to make things happen. And so you shouldn't feel like you're the only one encountering any difficulty or anything like that. That's another reason to show that there are normal people like you doing these things as well and experiencing a lot of the things that you are.
Yeah. Yeah. Well, and I think it speaks volumes because this doesn't happen in a vacuum. Like those other colleagues speaking to you in the way that they did, that's going to spill over to whatever patients they have as well. You know, and it flows over everywhere.
It does. It does. And that's such a great point too, because it has really shown me as someone who like kind of has broken that door, that like invisible door, like where it's like to see the other side of things and then see how we get to these doctor-patient interactions that can be so harmful to people. I can see it where it comes from now, because I'm like, if you're talking to me like this, and you know that I have an MD, and you know that like I trained just the same way that you did, I can only imagine what you're saying and how you're treating people who you don't necessarily think have the same educational abilities. So it's really instructive. And that's why, like, one thing I like to talk about on my social media platforms is that, like, no, like, it's not in your head. Like, it's not in your head. Like, you know, sometimes what's being told to you, or some of the ways people are interacting with you, is exactly like what you think they are. Because I think a lot of times there's like medical gaslighting, because
absolutely.
Yeah, because it's like, but I didn't say that, you know, but I didn't like, you know, like say anything racist or sexist or whatever, but it's like your tone, like the phraseology that you use definitely lets me know what you think. So I think that having a doctor tell you too, like, hey, it's not in your head. There are people who are not taking your concerns seriously, is important, so that people can heal from those interactions, and hopefully like also start a conversation with my colleagues, like, hey, we have to do better. We have to do better. Do you not see, like, one of the big things I love to show people, even at work, or like, you know, if I'm having conversations with other docs, like kind of like off social media, where I'm like, hey, like, you think that it's in people's heads or people are blowing things out of proportion? Take a look at my comment section. Take a look at what everybody's saying, because like all of these people have very similar like experiences, and they're from all different parts of the country and sometimes world. So clearly it's not a one-off.
Yeah, I mean, I've been told, you know, when I go in for a specific issue or potential infection with my vagina or vulva, that like, you know, the doctor will say something and I'll be like, I don't know, it doesn't really feel like that. And it's like oh, well, you know, I've been doing this for 20 years. And it's like, oh, okay.
Right.
I guess bitches just don't know her own body then. Okay, cool.
Right. Exactly. And then also too, I just think for me, it's like, explain your rationale. Saying because I said so is not okay. I didn't respond to that well as a child. Neither
did I.
Most of us didn't respond well to, you have to do this because I said so. We didn't. So that goes on further in life. So as an adult, people do not respond well to, take this medication because I said so. This is what is happening to you. This is what disease process I think is happening to you because I said so. Even if, like, you know, you really do think it's that disease process, or you really do think that this patient will benefit from this treatment course or medication, explain how you got there. Explain it. Do not think that, like people are not capable of understanding that. And if you can't explain it to people in the way that they can understand it, maybe you should look more inward and less outward, because that's like the first thing I always start when people are like, well, you know, I don't think they're going to understand it. Well, then what are you saying? Because there's always a way to explain something for people to understand. You know, and it's like, it's not okay. It's like if somebody doesn't speak English, right? We now have it solidly in our medical practices, right? And it's like you need to get a translator. And like a proper translator to translate for that patient into a language they can understand. If there are forms they need to sign or consent forms, things like that they need to sign, and they don't speak English, we need to have consent forms in their language so that they can have informed consent and consent for that. To me, that goes with health literacy as well. I don't think it's appropriate to tell somebody, okay, your only option for this issue, this bleeding issue you're having is a hysterectomy. And not thoroughly explain their options in language they can understand, explain what the surgery entails in language they can understand. Because to me, you're speaking a different language. Yeah, it's English, but it's not the English that we all learned from growing up. Like medical terminology is
I've had that where like I've been told I have a yeast infection, even though it doesn't feel like a yeast infection. And she's talking about the like yeast particles underneath the microscope and the number. And I'm like, what the fuck are you even talking about? Like, I don't know anything of what you're saying. Like it
exactly, right? Like, because that's my thing. I'm like, let's be practical about this. Like health literacy is a thing. And that's kind of another reason why I wanted to like be active on social media, be active like on the internet, because okay, like most of our available information about a lot of things that happen to vaginas and vulvas and uteruses and all of that stuff is either like Mayo Clinic, WebMD, which is like, again, I think not very layman term friendly. And then also usually scares you to think that you're like have cancer, going to die. Because trust me, before I was in med school, I was a WebMD girl. I went on WebMD and I was like, and I would like be in tears sometimes. I'm like, I'm going to die. Like I'm going to die. I have cancer. I'm going to die. And then it would be like, go to the doctor and they're like, what have you been reading? That's no. Or it's like people who, you know, have had their personal experiences, which I'm not going to invalidate that because we all have experiences personally that are valid and that can help people. But the thing about it is that we're not all the same, right? So what happens is that, okay, like someone who, you know, starts a blog or has, you know, an IG account who may be suffering from something similar than you are, you know, puts posts and talks about in language that you can understand what's going on with them and their treatment course. And you're like, well, that's it. That's what I need. That's, you know, and that's not fair to you either, because that is that person's experience and yours may be different and they don't have access to your medical records and you don't have access truly to theirs. So it may be hard for you to like know if you should take that advice or you should listen to what they said or whatever, because you're not the same, right? And so, like, I just felt there needed to be something in the middle, like where it's like, okay, like WebMD and Mayo Clinic and all of these like websites are like somewhat hard to understand and really are hard to kind of parse through. And then there's a lot of like people out there who are talking about their personal experiences with everything and are being really good with advocating for people and advocating for, you know, like more knowledge about these subjects and try to make it more accessible. But then again, it's personal experiences. So I wanted something that was a little bit in between where it's like, you can understand it. a little bit better. You can at least know what kinds of questions you should ask your medical provider about what's going on with you and take it from there. So that's where that's the sweet spot I've been trying to achieve, where it's like, okay, like here's your like tidbit of information. Hopefully with the struggle twerk and a little like fun music, you can understand it better. And hopefully it like also sparks some, you know, curiosity too.
Yeah. Yeah. Well, I'm wondering if we can switch gears a little bit here to talking about some specific like vaginal things.
Sure.
And sharing a little bit of your like educational knowledge and experience here. One thing that like I don't think I've ever really talked about on the podcast is this whole discussion around the hymen. And in last week's episode, we were discussing purity culture and how that relates to masturbation. And something that I've just kind of been sitting with, you know, was like, oh, this concept of like, if you use a tampon, then like you're all of a sudden breaking your hymen and you're no longer a virgin and all of that ickiness. If we can talk a little bit about the hymen and like how that actually works.
So, yeah. So the thing about the hymen is that it's just a part of your body, right? It's a part of the body. So like not to get all like nerdy and sciencey, right? I'm going to like keep it brief, but basically like it's really interesting how the female reproductive tract kind of gets to be as it is. It basically like is like two parts that fuse together, and then it's like a whole bunch of tissue, and then it kind of all kind of disintegrates in a way, and then we have remnants of things, right? So the hymen is kind of a remnant towards the external part of your vagina, like so closest to the outside, that usually is kind of a whole sheet across the vaginal opening, like not like on it, but like a little bit internal to that. And as you get older, it gets smaller and smaller, right? And sometimes when people first have sex, sometimes when they play sports, sometimes when they use a tampon, sometimes when they are just walking down the street, that can break a little bit, right? And so now that opening that was once covered over, like when you were a baby, that then became less covered over, and there was like kind of like a ring there, like what we call the hymenal ring, that tissue can break, right? And it's not necessarily when you first have sex, because any sort of like physical traction or anything can break that, right? So it's a social construct that breaking the hymen means that you are no longer a virgin, right?
Yeah. Well, even like virgin is a social construct.
Yeah, virginity is a social construct, okay? Because then, like, another thing that I think I've had a lot of conversations with my patients, a lot of my lesbian patients, or, you know, who don't have penetrative sex, they're like, well, am I a virgin or am I not a virgin? Because
why does it matter?
If we're talking about, yeah, exactly. If you're talking about penetrative sex, right? Like, I haven't done that. And then I'm like, well, that's why that is probably like this whole concept of virginity is something that we kind of need to divorce ourselves from, because quite frankly, all types of, you know, like any type of sexual contact could be considered losing your virginity. And then like if you're using the hymen, which is literally a piece of tissue in your vagina as like what makes you a virgin or not, like then walking down the street can cause you to lose your virginity at whatever age. You know what I mean? Riding a horse can do that. Doing gymnastics can cause you to break your hymen. You know what I mean? So many things can cause it. So where do you draw the line? Where do you, what is virginity? Like, where, like, what does it all mean? Like, it's a very, very heteronormative concept too, you know? Because that's the biggest thing that I have, because it's like, really hard when we use that terminology with sexual activity, right? Because again, it's like, I ask my patients these questions, right? Are you sexually active? It's a very loaded question, right? It's like, well, if you consider being sexually active, having penetrative sex, right? Mm-hmm. Does oral sex count? Mm-hmm. Does anal sex count? Yeah. Like, you know what I mean?
It's all sex.
Does
it's all
a hand job count? You know, like what counts? I don't know what counts. So I like to be very specific when I ask these questions. And then also too, and not do it in a heteronormative construct too, because you will miss out on opportunities to talk to your patients about and talk to people about things when you assume that sex is only penetrative penis and vagina sex.
Mm-hmm. Yeah. Well, I had no idea that you could lose your hymen just walking down the street or break your hymen.
Like, I mean, it'd be an aggressive walk, but...
Hey, I am a fast walker. I really am. I am a fast walking walker.
It's like, exactly. But it's like, it's hard to know too. You know what I mean? Because sometimes also people may not know, like may not believe when they first break their hymen as well. So that's the other thing. It's like, okay, like I can do an exam of someone with a vagina at any age, right? And notice that they don't have like, you know, like a hymen or their hymen is broken, right? Mm-hmm. But that doesn't have anything to do with sex or when they had sex. I couldn't tell you when it happened or how it happened. Mm-hmm. And sometimes, you know, the person can't tell you how it happened, and that's okay.
Yeah. It's really, it's patriarchy right there. This whole emphasis on hymen and virginity, patriarchy and white supremacy. But that's wild. I didn't know that the hymen fully worked like that. And I guess I'm wondering too, like what kind of, like, I know most doctors don't receive like real nutritional education, right?
No, we do.
But like, and what about like sex education? Like I'm assuming as
That's
an
another
OBG,
thing we don't get.
But I'm assuming as an OBG that there is more of that included, or no?
Somewhat. Yes and no. Yes and no. Okay. So
I hate it here.
Yeah, I know, right? It's like, ooh. Ooh. Like, exactly. So here.
Oh, your volume just went out. I can't hear you.
No?
Yep, there you are. You're back.
Okay, I don't know what happened with that. Can you hear me?
Yeah, I can hear you. Yeah.
Okay. Oh, I think it was my Wi-Fi was like a little rocky. Oh. All right, but we're back.
Yeah.
So it's like a little like it's cringy, right? Like the lack of education we get, not only in nutrition but sex, right? So like we do kind of like your basic, like all docs get like a reproductive health rotation or a class in med school, right? And then we all do an OBGYN rotation. But Western medicine is big on actual, like, here's a problem, here's how we solve it, like, period, right? Like, it's not like, and then when there are too many gray areas, I think Western medicine gets like a little scared and they're like, we're just gonna like gloss over and hope somebody else picks up that slack. And so that's kind of how it happens. So in OBGYN residency, that's where you get trained to be in OBGYN, we do have more education about it. But, you know, in terms of some of the disorders that people have in terms of like hypoactive, like, you know, sexual disorders, things like that. We don't get a lot of that.
Like vaginismus?
Vaginismus, again, it depends on the program, like the residency program, how much of that you get. I actually got a lot of training with that because what was integrated in my residency program was a whole rotation where we spent time with a pelvic floor physical therapist.
Okay,
and so we actually helped them out with those assessments, learned how to do a good assessment for vaginismus, learned what types of treatment courses that the pelvic floor physical therapist did with their patients. But like, that's not the norm necessarily. So there's varying degrees of comfort depending on what doctor you see. Something that's nice is that on the horizon, I think those of us who are closer to our training are getting more information about that, but it's not the norm. You know what I mean?
That's so disappointing.
It is. But I think that there are also a lot of docs who are really interested in a lot of these things, especially those of us who are coming out of training or that are younger in our career. And a lot of times we take steps in addition to what we've been trained to do to learn about these things. So like the best thing you can do, and what I was taught in med school and residency, which I take to heart, is that you should never stop learning. Like once you're done with your training, it shouldn't be like, all right, guys, like went to school for this. Cool. Like medicine is ever evolving, ever changing. And we only get 4 years to learn, like in residency. And like for OBGYN, our residency is 4 years. That's the time we learn the bulk of our stuff. And that's just not enough time. So you have to keep learning.
Yeah. Because there's so much that could, like, just the vagina on its own, the vagina and the vulva, just like so many things can happen there. There's so much to learn just with that. Like
so many things. And that's the reason why too, like also knowing your limitations, right? So I always caution people to be concerned, like if you go to a doctor and they seem like they tell you they can fix it all, right? Because I feel like a lot of old school docs are of that sense of like, like I'm just going to give you this stuff and I can fix it all. Like, you know, I can do everything. We can't. The body is so complex and so insane. It's insane that we're able to function the way that we do. It would be remiss for me to say that like I can take care of all of your vaginal complaints, that I can take care of all of these things. You know what? Sometimes you have something that you may need a specialist whose only job is to take care of people who have vaginismus or have chronic like dermatologic issues of their vulva or, you know, have pelvic pain or, you know, have fibroids or whatever. Sometimes it's nice to go to the specialist who knows how to do that thing. And it's not necessarily your doc being like incompetent for sending you to a specialist. They actually probably just want you to get your best shot of living your best life, honestly. And it's not that they're trying to just push you away. It's a lot of times where it's like, listen, there are limits to what I can do for you. There's limits to how I can take care of you. And this person spent years additional training, just learning about the vulva, period. And they see every day, all day, different vulvar issues and they can help you better. Or with vaginismus, it's such a complex thing that you want somebody who spends their day just dealing with that problem. So I always tell people to be cautious of the doc who's like, I'm the jack of all trades. I can do it all. And I think I do it all well, because that means that you may be shortchanged in some way if you have if you have a specific concern and it's not cut and dry.
Yeah. Well, and vaginismus is one I definitely want to do a future episode on. But even just in talking about like the vagina and the vulva, there's so much cultural shame and stigma around even just saying the word vagina, honestly. There's so much lack of awareness even on what the vulva is. So I'm wondering, you know, from nutrition to sex to like mental health training involved in like being an OBGYN, of like how you do care and how you do, you know, tend to patients who, you know, that's like one of the most vulnerable things is sticking your feet up on that damn thing and spreading your legs and scooting all the way down and scoot a little bit more and just asshole and vagina straight up there in someone's face. Like that's a super vulnerable thing to do around something that probably feels uncomfortable or painful for you. And, you know, just I don't think I've ever seen a male OBGYN, and I really don't know how comfortable I would even feel with doing that, because at least with a female doctor, I'm like, well, you kind of know, like you probably have felt this weird sense of like shame or guilt around like having a yeast infection that is stupid and like you shouldn't feel because it's like natural and all of this, but like there's it just comes up. It's like,
right.
It's really hard to fight against, even when you are educated, even when you know what's happening, I think. So I'm wondering how, like, either how you go about that in your practice or like what that looks like in your education.
Well, one thing that I feel like over time I've gotten really good with, because I'm also, full disclosure, like the worst GYN patient ever. I'm literally like sweating and stressed and like, like can't even deal. And that's probably, cultural things and like all of that, because I suffer from the same things too. So it's like, I think that also informs a lot of what I do. And to be fair, I have a lot of male colleagues who are amazing at like making people feel comfortable during their exams, just because, I feel like even for some of my male colleagues, they're like, this has to be really, really awkward for you. So they're like trying their hardest to make it as least like traumatizing and awkward as they can, So for me, over time, I've realized a big thing to do is like have my patients set the ground rules, I'm like, this is your space. This is your time. Like, if you don't want to do something, we don't have to do it right now. Okay. Like because to me, I feel like sometimes it's the rush, right? And even the patients in their minds too. Like, I just have to get this done. Like and then it creates anxiety. And when you have that anxiety, it actually causes your muscles in your vagina, around your vagina, in your pelvic floor to tense up. And that causes more discomfort, pain, and all of that. And that feeds into all of the mental stuff as well.
Definitely.
So sometimes for some patients, they're not ready to have like a full-on exam, that appointment, that first time they meet me. Because guess what? Like, some people don't open their legs to like people they don't know the first time they meet them. And that's okay. And so I say, you know what, if you're not ready to have this portion of the exam this time, that's fine. We'll do, you can come back and reschedule it. If there's any time in the exam you feel uncomfortable, then we can also, reschedule that portion. We'll just go up to wherever you're comfortable. I think that usually helps with a lot of it. And then I tell cheesy jokes and, try to like make it light and like, and then also read cues from people. It's like, I think pushing too many times we push through things that are uncomfortable to just get them over with, whether it be doctors, patients, or just in general life. And I think in the GYN space, we need to be a little bit better about that. Like, I think we should not really aim to push through like these uncomfortable exams or uncomfortable situations.
Yeah. Well, and doing that, you're also then teaching your patients how to like initiate and honor their bodies and their boundaries in that as well, which is kind of a light bulb for me right now of like, your doctor's office, hopefully could be one of those first spaces as you're growing up to be able to learn how to honor your body through those kinds of conversations, through those kinds of questions of like what you're feeling comfortable with and what you're not feeling comfortable with, and how to care for yourself in that moment, and how to honestly also have respect from that other person as to what is going to be good for your body.
Exactly.
I've definitely had experiences with doctors where it's just like, you can tell I'm super uncomfortable. And like, I'm even saying like, I'm really nervous. Like, this makes me really uncomfortable. And they're just like, well, we're going to be quick.
Yeah, exactly.
Okay.
Yeah. And it's bodily autonomy, right? We need to teach people that in all aspects, because it's like, if you don't feel that you have control over your body in like a doctor's office or, or in a medical space, what's to say in another like part of your life or another place that you would feel also empowered to, say no, things like that, or like speak up for yourself. So I think it's so important that we teach that to people, because also too, as I mentioned before, if I believe that whatever I'm doing is so important that I need to do it at this appointment, I should be able to tell that to you and you understand that. If, for example, it's uncomfortable and after I've explained it to you, you're like, I still don't want to do that, I have to respect that. But what I don't like is when it's like, you haven't thoroughly explained what's happening. And then it's something that can be uncomfortable for people. And then the patient is like, kind of, saying, well, I don't know, like, and not feeling empowered necessarily to say, no, I do not want this. Right. And then you still like proceed anyway. And then I think that, and then usually the patient more so than the doc leaves that experience feeling upset or whatever. And they may not be able to verbalize it to the doc, but like, as I have told a lot of my colleagues, just look at my comments and you can read people's experiences and the harm that it causes and the distrust and the pain towards the medical system that it starts. Yeah. So that's why I'm like, we have to be cognizant of what we do and you know what? And listen to people when they say, I'm not feeling this. I usually say, okay, we're going to stop right now. And then I'm like, so, what do you want to do? We can stop and be done with it completely today. That's totally cool. We can try again. It's up to you. Yeah. There's no wrong answer here, Yeah. So, and then if they choose to be done, we're done. And it's not like I'm going to be like passive aggressively being like, well, if you were allowed to do this, then we would know, blah, 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 blah. Like not the, just like truly honoring someone's decision. And I think that needs to be done more often in medical spaces.
Yeah. Can you come down here and look at my vagina?
I mean, or you can come up and visit me.
Yeah. I say down. I'm like thinking like I'm back in Baltimore and you're like up, but I'm in Seattle. So actually be like,
I was like, aren't you here?
When I think of New York, I don't know. I just immediately like placed myself back in Baltimore. I lived there for like 8 years.
Funny.
I'm like, yeah, come down from there. But yeah, no, it's been so fantastic having you on. Can you share a bit about like where people can find you, where people can follow some of the work that you're doing and, get an opportunity to kind of learn a little bit more from you?
Cool. So I am on both TikTok and Instagram, primarily on Instagram. My handle's at Dr. Heather Irobunda, MD. If you put Heather Irobunda, I come up. I'm the only one of me around. And yeah, I do lots of like fun stuff, I think, like talking about vaginas and vulvas and talking about periods and talking about things that are like sketchy, but like what we need to know, guys. So come through, enjoy, join the chat. Yes. It's a good time.
I love it. Well, thank you so much.
Yeah, thank you.
All right, that does it for today's episode. Thank you so much for making it all the way through and keeping your ears, your hearts, and your minds open. It would mean so much to me if you could take a second or two after listening to this episode to leave a review on iTunes and let me know what you're enjoying about the show. I love reading, what your favorite episodes are, where you guys listen, and definitely feel free to share this with a friend. I mean, part of how we break down the stigmas around these topics is by talking about them, right? And sharing them with more people. So definitely share the podcast. And again, really wanting to include all of you in this podcast. So if you have questions or you want to share a thought or an experience, please send in a voice memo to ask.letstalkaboutit@gmail.com. And I'm really excited to keep having these conversations and breaking down these stigmas. So thank you all so much. I hope you have a wonderful rest of your week, and I'll talk to you next time.